Good evening, all. This is Kavipriya, lecturer from the Department of Cardiac Technology. Now, the lecture class is about principles and technique of echocardiography. The principle and technique of echocardiography will explain about what is a regional wall motion abnormality and how it can be able to identify in a patient using some criteria. Here, what is regional wall motion abnormality means? It is a key indicator of ischemic heart disease, and it is a myocardial infraction also. It is early detection guide to diagnosis diagnosis the regional wall motion abnormality that is maybe due to ischemic heart disease or what, and prognosis management of coronary artery disease. So echocardiography provided the non-invasive technique and real-time window to myocardial contractile function. Here some images are there. See, there is an apical, mid and basal level of LV are mentioned here, and apical segments, there are 4 segments are there, 6 segments are in mid and 6 basal segments also there. So totally we having 17 segment model. One is at this apical cap. So here basal segments are located around the mitral valve level. In see, this is basal valve level within the mitral valve. It consists of 6 segments, and mid segment consists of 7 to 12 that is positioned in papillary muscle level, presenting the middle portion of ventricle myocardium. This is the middle portion of ventricle in myocardium, LV, mid level. There are also 6 segments are there, and another one is apical segments. 13 to 16 segments are projected there, located at the distal to papillary muscles, and apical covering the 3 and 4 segments, which is including very tip, and apical cap also there. See, the apical tip is itself unique single segment at the ventricular apex. LAD territory, the left anterior descending artery supply the anterior and anteroseptal segment, which is representing the most commonly affected coronary artery distribution in myocardial infarctions. LAD and LMC are here. The red color mentioned as LAD territory, the blue color is mentioned as RCA territory, and the yellow color mentioning as LCX. Here the yellow color, here the lateral segments are mentioned as yellow color, that is circumflex artery. The plotted one is mentioned as RCA, and also both the circumflex artery, LAD and circumflex also red color plotted thing, and purple color mentioning LAD or RCA, which is dominant artery, may also be distributing blood to the segments of LV. LCX artery, that is left circumflex artery, the vascularize are infralateral and anterolateral segments. Infralateral and anterolateral segments through the anatomical variation existing among the patients. Here infralateral and anterolateral segments of LCX, which are passing the blood to the heart, and see, the segments are 11, 12 and 13, 14, 18 segments also comparing there. Apex, blue color mentioning RCA, and yellow color which is LAD, and purple mentioning LCX, and another one is RCA territory, which is right coronary territory, perfusion inferior and interseptal segments, which occlusion means it are often causing the inferior wall MI because single artery are there, so it may cause inferior wall MI. This is red color mentioning LAD, yellow LCX, blue RCX and LCX. Here RCA, a single major artery which is supplying blood to the inferior portion of the heart. This is 2 chamber window, one is anterior part and another one is RCA inferior part. Here to assessing the wall motion abnormality, one part is known as akinesia, another is dyskinesia, hypokinesia, and global normokinetic also there. See here the akinesia mentioning the complete absence of motion, which is contraction of LV, and the thickening during the systole, and suggesting a severe ischemia or transmural infraction. See, this is the akinesia. Thickening also be increased during systole, which means contraction. and there is no contraction also. See, here is akinesia, no movement. So endocardial excursion is about 0 to 2 mm. It is about 0 to 2 mm. So absence of systolic thickening also there, absence of systolic thickening, and also presence of incomplete movement. Second one is dyskinesia, a paradoxical outward motion during systole. It is often indicating a ventricular